to you guys about something. So I had a lot of follow-up DMs and questions from the video I did last week about the red flags when looking for post-op massage, what you actually need. So we're going to do part 2 and kind of go over those a little bit. The first one I had is how long should your massages be? Now, let's keep in mind, we are talking about true hands-on Vater-style manual lymphatic drainage, which is this gentle pumping motion. We're not talking about rubbing, squeezing, pushing fluid out. That's not proper post-op care, and that's against all violations of massage therapy license in pretty much all the states. Just because they're doing it doesn't mean they're not going to get caught, doesn't mean it's not illegal. So let's start with that. So when you're going to get these massages, right, this system that takes care of your swelling in your body, the lymphatic system, is meant to dilate and suck fluid back. We're not pushing fluid. We're not moving fluid. We're not doing any of that. All we're doing is dilating your lymph vessels. I'm not pushing fluid anywhere in your body. So people that say you need like an hour and a half, an hour and 15 minutes, that's not how that works. By doing more, you're not dilating your lymph vessels more. Once they're dilated, they're open and your body's going to do its thing. So anywhere from 30 to 45 minutes of hands-on manual lymphatic drainage is what you need, or like 50 minutes at most. But again, anything after that, you're just rubbing into the tissue, and you shouldn't be rubbing anyway. You should just be doing this gentle, very light pumping motion. It's like a feather light touch. All I'm doing is placing my hand on top of the skin and moving the skin. That's it. I'm not pushing like this. There's a very big difference. So when you're talking about doing that, the point of these massages is not to push fluid anywhere. It's to dilate your lymphatic system, to get it to open up and suck the fluid back naturally in your body. So doing anything more than 45 minutes, yeah, it may feel good, but you're not getting more fluid. You're not stimulating the body more. That's not how that works. Once your drains are open, once your drains, meaning your lymphatic drains in your body, at your neck, armpits, and hips, once those major sites are open, and we're working on opening and dilating all of the little vessels that are only a hair thick, once we're doing that, anything more than 45 minutes is not going to make more swelling come out of your body. That's not how that works. So 30 to 45 minutes is going to do enough for you for what you need. 50 minutes, sure, if you've had a lot of work done. If you had arm lipo, thigh lipo, back lipo, 360 all the way around your abdomen, and you had a breast augmentation, and you had a tummy tuck, yeah, we may need a little bit more time to cover all those areas. But it's about covering areas and dilating vessels. It's not about the longer the massage, the more fluid you get out. That's not how that works. And if you guys are totally lost, go watch last week's video where I explain why, and the anatomy and the science and the biology of how the lymphatic system works for your swelling post-surgery to get the fluid out. So 1, longer is not better in your massages. 2, you should not need 30, 40, 50 massages. You should not need 6 months post-op getting maintenance for your swelling. If you have swelling, 6 months post-op from lipo, tummy tuck, BBL, any of them, there is something major going on, and you need to schedule a virtual with me, and we need to figure it out, because your swelling is not supposed to take that long. Guys, when you stub your toe, granted, let me preface this analogy real quick. Yes, cosmetic surgery, you're going to have way more swelling. It's a bigger area, and it's a lot deeper, and it's a lot more work being done. But when you have swelling, you bump your toe, and it's swollen, right? You don't get massage every single day, all the time, until that swelling goes down for God knows how long afterwards. That's not a real thing. That's one of those Miami markup gimmicks that they made so that they can make money off of you, because they're charging dirt cheap prices, giving you misinformation that you guys are listening to because you have no other resource, and you're not doing any kind of research on the body physically and how it works. You're doing YouTube, Instagram, real self, heard it from somebody who did it somewhere research. That's not textbook research. That is not going on the internet and Googling the lymphatic system and how swelling works in the body and how to get this out. That's not the same thing, guys. So, again, they do not need to be extremely long, and you do not need a million sessions. Why? Because again, how the system works. Once your body reabsorbs that swelling, even if you are doing like all the wrong diet things and all that stuff is happening, if you're coming in and getting true hands-on manual lymphatic drainage, once that swelling is absorbed by your body, you pee it out. Once it's in the toilet, you flush the toilet and it's gone. What are you getting massages 6 months out for maintenance for? It's not how that works. If you're getting massages for maintenance, your massages aren't working, period. You should be getting anywhere from 8 to 12 to 15 if you had a full body reconstruction, 8 to 12 to 15 at max hands-on manual lymphatic drainage massages. When do we do that? Sometimes starting 48 hours after, go back to my previous video, depending on what you had, sometimes starting a week after. But either way, it should be 8 to 12 to 15. That's it. So this whole like 32, I get rubbed and squeezed and pushed with oil and I still have fibrosis. Guys, if you've done that many massages, if you've done 20, if you've done 18, and nothing's happened and you're still in pain, you still have fibrosis, you're still super swollen, the massages aren't working. It's meant to get your body to reabsorb the fluid and pee it out naturally. If they're cutting you open and constantly squeezing the crap out of your incisions and telling you, oh, there's nothing coming out, you should still come back and we're going to use a wooden roller and break up your scar tissue, and you've already done 15 massages, guys, it's not working. If you are doing things for a really long time, super consistently, and they're not working, it doesn't mean you need more. It means you need to change your tactic and do things differently because what you're doing isn't working. And I had so many DMs this week from last week's video. Oh, I did this many massages. Oh, what about this? Oh, what about these massages? Guys, no. If you are having someone cut open your incisions repeatedly, or having someone rake their hand over your incision with oil repeatedly, even if they're not cutting them open, if they're using a machine on your incisions repeatedly, constantly disrupting the scab and the healing, yeah, you're gonna never heal right. And they're gonna tell you you need to keep coming back for more. My biggest thing, I never, and you guys know this, we have a very extensive booking process before you get to see me. I never allow anyone to book a package before seeing me, number one. Because the biggest question I have is, how many massages do I need? When am I gonna be done? What's my timeline? What were you doing before? That's what matters. Because you can be 30 days, 45 days post-op and still look like you're 10 days post-op. So I don't know. There's no way to tell you because I don't know what the situation is. I don't know what your body's environment looks like right now based on what you've done. So again, anywhere, at any point in your healing, you should only need at maximum 15 Vater-style manual lymphatic drainage hands-on sessions if you're doing the at-home care right, if you're not doing all those other crazy massages that are messing you up and setting you back, if everything is happening right. The people that start with me, usually it's only 8 because we're doing the at-home care. I'm on top of you guys with everything as far as your products, your faja, making sure you're wearing it, your foams, everything. I am on you guys all the time to make sure that we're getting this done as quickly as possible. Now, after you finally get in to see me and we talk about packages, still in the room, I never, except for very rare cases, never let anyone book more than 8 sessions. Ever. Because if you're doing the things right at home, you may not need those 15 sessions. You may need 8 sessions and that's it. You may not need all this extensive, crazy stuff that you hear online or see online. Because again, what they're getting done, 1, is not legal in a lot of places. 2, goes against everything with your body and healing. 3, the science, the biology, the anatomy, and the physiology of post-op body backs all of that up. That is not okay, and that's not how the body heals, and that's not what you need. So I never let anybody book all of those sessions because you guys are scared. You're freaking out, your body doesn't look right, and you want it to look right, and you're trying to get right, and you're trying to get snatched, you're trying to do the right things with the wrong information. So here I am, giving you the information. But I don't ever let anybody, until we actually get you on the right track. Because a lot of you guys come to me with all these issues, which is fine. A lot of you guys come to me, and we have to figure out where in your healing are you. Not how many days post-op, not when did you get back from DR or Miami, not when did you start switching up your faja. Where is your body right now in the healing process, and how much do we need to do to get you back on track, number 1. Number 2, get you healing properly. And number 3, where's it going to take to get your results? How long is it going to take? That's the other big question that I've had is, okay, these massages, blah, 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 how long should I be doing them for? It's not about how long. It's not about how long your sessions are. It's not about how long you're doing them for or how many you're doing. It's about where is your body and what does it need. So if you are coming straight out of lipo, right? Let's take an extreme case. You're getting lipo 360 and BBL, super common. You're going to Miami. You're staying there 2 weeks. You're getting their squeeze massage there, and you come back home, and you see me the day after you come home. You're now 2 weeks post-op lipo and BBL. How many sessions do you need? Well, it's not like your fluid is fluid anymore. It's fibrosis. That takes time to dissolve in your garment with the foams. Number one. Number two, how's your diet been? Have you been eating trash? Have you been dehydrated? Have you been having coffee? Because that's all going to make you swell and play that whole thing up even more. So that's going to take longer for you to heal. That's number two. Number three, have you actually been taking care of your incisions? Have you actually been using proper products? And when I say taking care of your incisions, I mean using proper products that aren't sending you backwards in the healing process, because that is possible, guys. It's not just, okay, my body's going to heal. It's not just, oh, okay, well, I'm this many days post-op and this, I'm going to heal. I'm going to trust the process. Guys, it is possible, very possible. And I've seen 4 today people, very possible, where your healing goes backwards, like from surgery straight backwards. And you guys are basically starting from scratch the minute you come to see me, because you're doing all these things that are breaking tissue and causing more damage than the surgery did initially. So now you're not just dealing with surgery damage, you're dealing with surgery damage and abuse to the tissue after surgery because of these squeeze massages, because of the faja that's too tight, because you're sitting on your BBL because your BBL pillow doesn't work. We got to clean all that up first before we even worry about how long is it going to take me to heal, or how many sessions do I need, or any of that. That's all what we do in the virtual consults and the post-op consults with me. That's the difference between seeing a specialist and seeing just somebody who does post-op manual lymphatic drainage. They can't tell you. They have no idea. They haven't done the medical research. They have no idea what post-op body is. So they're not going to be able to tell you, oh, okay, this is how many massages you're going to need based on where your body is in the healing process. They don't do that. They just say, oh, this is what you had. You're going to need this many massages. Or just keep coming back until you're healed. But when is that? How is that? How do I know if I'm healed? How do I know if these things are healing right? This is why you come to me and find a specialist. But on top of that, yes, it's very possible to go backwards. And you hear it all the time on Real Self, on Instagram, on Facebook. All you guys are freaking out. You want to book 1 million massages. You want to get in today. You want to do it now. You got to come home and get it immediately because you're in such distress. But guys, you're rushing to book sessions and choosing to do it with someone who's doing squeeze massage because that's what you were doing out there is what is throwing you backwards on the post-op timeline. Completely backwards, because you're not making educated decisions, because you're not taking the time to research this stuff and figure it out, and you're just doing things willy-nilly thinking, oh, my body's going to heal anyway, I'm just going to try everything. And then 6 months down the line you come to me because guess what? Your body healed, but it didn't heal right. And it didn't heal with your results the way you wanted it. It healed all kinds of swollen and fibrotic and messed up because you were doing all these things, rushing and hurrying to try and get this done and heal and do all these massages, but you weren't doing the right kind. And that's the questions that people keep asking me is, oh, I've already done 20 massages. Why do I need more? Why are you asking me if you need more? What's wrong? What didn't heal right? What do you still have going on? And the first question I ask you guys when you walk in the door is, what are our major concerns? Tell me what's going on. Because what you think is going on is all the bad information that they gave you and not the actual biological, anatomical proof of what your body's going through. It's you not knowing anything medically, you not knowing anything about the body, biology or anything, of how the body's supposed to heal or any of the functions and processes through this whole thing. And people just giving you random pieces of information and you trying to put it together in your head. So back to the original reason I did this video. How many massages do you need? Depends on where you're at in the healing process. How do you know? Depends on how your body's healing and what it looks like and how it feels. You can be 30 days post-op and still have a post-op body that looks like it's 3 days, 10 days, a day after surgery because they cut open your incisions so they never healed and they've got all this stuff. I'm trying to read the comments. Guys, I'm going to have to get back to you after this. Please, if you're sending me comments, please send me DMs because I still have a lot of other things to talk about. This video is going to be really long if I answer all the questions. So anyway, all these things, all these questions that you guys ask, the short answer to it is, with your massages and with your post-op process, it is so specific. It is so individual. It wouldn't be as individual if we had the proper information out there in the post-op world from jump, right out of surgery. They told you what it was. They explained to you the anatomy of the body. They explained to you how you heal. They explained to you why, and you were good to go. No one's doing that. I have a few people on Instagram that I'm friends with and me that are doing that. Other than that, there's no one doing it. So when you guys are trying to figure out how many massages do I need, find a post-op specialist. Set up a virtual with me. Call Alex in our office. Happy Alex, that everybody calls her now. That's like the new thing. Call Alex, because she's always super happy. Call Alex, 732-841-0142. She can get you set up with a virtual, and we'll figure out, based on where you're at, how many you need. But when you're looking at massages and you're looking to start this healing process, it is entirely up to doing the right thing for your body. If it doesn't feel good, it's no good. The hard part was supposed to be the surgery. The painful part was supposed to be the surgery. Aftercare should be a nice, soft, gentle, comforting thing. It shouldn't be stressful. It shouldn't be painful. You shouldn't be crying during your massages. You should not have to take all these oxys and perks before your massages. I beg you guys not to take that stuff when you come to see me, because I need you clear. I need you to be able to tell me what's going on. If you're fogged out, if you're not listening, if you're not absorbing any of the information, your consult is a complete waste, because you're not going to get your instructions right. You're not going to know why you need the things. And then even if you absorb it, you're not going to remember it when you go home. So you should never have to be on, first of all, you shouldn't be driving or traveling or out anywhere in the world if you're on narcotics and pain pills. Number one. Ever. Number two, if you can't get up and get to us, it's too soon for you to come in. You're in way too much pain. You need to wait, because again, we need you to take control of your healing process and figure it out. I can tell you how many massages you need, but guys, if you don't come in to get them, I can tell you what you need post-op and how to use them and all our products and explain them to you, but if you're not using them, it's not going to work. We're a team. That's how this works. So I'm here to educate you guys so you can do it at home yourself. But as far as like, okay, so how many do I need? It really is individualized, and it wouldn't be if we had the information beforehand. We would be able to say, okay, this is how many you're going to need. This is what your post-op healing is going to be like. This is what your process is going to be like. This is what to expect with your incisions. If this happens, you let me know, and we'll figure it out because you're doing something wrong. That's kind of how it should go. And that's how it goes when you come in to see me. But when you're looking at like, oh, I need 30 massages. If you need 30 massages after lipo, something's not working. Guys, it should not be this hard. And with us, it's not. It's a straight line. That's it. It's a straight line. And if your post-op is not a straight line and you're like all over the place and you're still like a hot mess in your head because you're like, oh, well, I did all these things and it still didn't work. What you're doing isn't working. You need to change your tactic. You need to start doing something else. Some part of your post-op process isn't working, and we need to figure it out and flip things around. If your incisions are still goopy and open and wet, your wound care is keeping you too wet because you're trapping moisture in there with a gauze and a ointment that's moisturized and keeping moisture in there. That was a lot. But something, if it's not working, guys, you need to change your tactic. You need to find other help. We are other help. We are a different standard of post-op care. We are the only standard of post-op care because everyone else is telling you to do all this crazy stuff. Guys, if it walks like a duck, if it quacks like a duck, if it looks like a duck, it's a duck. If it's stressful, if it's not working, if you've done 30 massages, then they're not working. If it doesn't feel like it's working, it's not working. It's as simple as that. So really, really long answer to a couple questions, but how many do you need? If they're telling you you need like a bajillion, then that's not the right kind. That's another big red flag. One more big red flag, if you're using products, if you're doing things, if you're in a faja and you are going numb, faja's not working. We got to do something else. So just try to keep that in mind, guys. Try to be a little bit more on top of it with your choices, and this all stems back to your doctor. If when you guys are choosing a doctor, you do not feel like the post-op care and what do I expect afterwards and preparing you to take care of your surgery is not there, you need to ask questions. Not the nurses, not the front desk staff, the doctor doing your surgery in your pre-op. Ask all the questions. And if you guys don't know what questions to ask, set up a virtual with me and I will give you a list of questions, go through all the things to expect so you can ask your doctor up front and get educated and find out so that you're not freaking out and frantic trying to scramble with your post-op care, because that's the most stressful thing to do. You're already in pain. So, guys, this was a short rant. I hope it was helpful. I will see you guys next week. If you guys need products, our post-op shop, link in the bio. We also have a bunch of Instagram things coming out this week with like post-op starter kit. So like if you've had lipo, these are the things you need and these are how many massages you need. If you've had lipo BBL, this is what you need. These are all your products. This is what they do. Here's why you need them. Here's where to get them. Same thing for lipo tummy tuck BBL. All in there. So those are coming up soon, so you guys have a little bit more like tangible, you can go through and read information on what you need. And I will see you all soon. Have a great night. Thank you for listening to my rant. Bye guys.